name is Dr. Laquita Jones, and I'm a pediatric oncologist at Cincinnati Children's Hospital Medical Center.
I am Claire Van Puybox, an assistant professor of Weill Cornell Medicine in the Department of Radiation Oncology, and I am also a St. Baldrick Scholar.
My name is Susan Cohn, and I'm a professor of pediatrics at the University of Chicago in the section of hematology oncology.
My laboratory studies acute myeloid leukemia, or AML. As it relates to targeted therapies, they're being utilized to treat cancers more and more. And unfortunately, we know that patients who are treated with targeted therapy can eventually acquire resistance.
And so my research is actually to use radiation therapy to stimulate the immune system of the patients so that it can recognize and kill cancer cells throughout the body. And so what we are hoping to find is new actionable targets, so new solution to activate the immune system with radiation therapy so that kids with cancer can have new treatment available to them in which the immune system will mostly do the job and not necessarily chemotherapy or radiation therapy.
I've been working in this field now for many decades and have focused my research on trying to develop better therapy for a cancer called neuroblastoma, which is one of the most common solid tumors in pediatrics.
I got into cancer research as a clinical fellow. So first year of clinical fellowship is all clinical in nature, and the latter 2 years are research heavy. So you can do basic science research, translational research, or clinical research. And I decided to do basic early translational research. And that's when I joined the lab of my mentor, Dr. Daniel Starchnovsky. And at that time, at the end of my second year of fellowship, I decided to apply for a variety of grants, including a St. Baldrick's Fellowship Award. And I remember getting the phone call from the St. Baldrick's Foundation to say, you got the award. It was a great surprise, but that's literally what put me on this path to being a physician scientist in pediatric oncology. I'm very thankful for the opportunity, and I'm thankful to the St. Baldrick's Foundation for really changing the trajectory of my career.
And so we got to this field of pediatric cancer research actually with the award of the St. Baldrick's, because my lab that we set up in 2019 was mostly focused on adult breast cancers. And so with the help also of my colleagues back in Colombia, Dr. Gatrell and Dr. Hu, they actually suggested to me to apply this concept to kids' cancer that we were already developing in the lab. And so that's why we started to get funding, networks, to really make a difference in this pediatric cancer research field.
I first got into this field during my pediatric residency when I had the opportunity to see many children with cancer, unfortunately, not survive their diagnosis. And I felt very strongly that I needed to try to do something to improve the outcome of these children with cancer. And so I elected to continue my training in pediatric hematology oncology, and I have focused on always having research being part of what I do in addition to taking care of children with cancer.
I would say the biggest accomplishment for me so far actually has been becoming a physician. So I'm really thankful to be a physician scientist, but you know, my backstory, which I won't go into in its entirety, is that I'm a first generation college student. So I didn't have, you know, people around me who were able to give me guidance and direction on how exactly to become a physician. What are some of the things you need to look out for, to pay attention to be aware of, etc. But, you know, despite the odds, which there were many of them, even including beyond just being a first generation college student, I was able to finish medical school and to successfully finish my training. So my biggest accomplishment so far, one of them, is becoming a physician. Thank you so much for this opportunity to share. I don't take it for granted. Thank you, thank you, thank you.
And so my proudest accomplishment in work or in life, and I should say in life, is really my daughter. She's 6 years old. She's the light of my life, and she's remind me constantly why I am doing this research.
I'm very proud to say that I can now look back after decades of work in the clinical trials group, the children's oncology group, as well as some work that I've done in my own laboratory, and have been able to make some significant improvements in the outcome of children with neuroblastoma. And in fact, when I started, I would tell families that their child with high risk neuroblastoma had about a 20% chance of being cured. And today I can tell families that their child has about a 60% chance of being cured. And while I'm very proud that we've made progress, we still have a long way to go. And so the research needs to continue. The other part of my career that I'm very, very proud of, however, and perhaps even more proud than the work that I personally have done in neuroblastoma research, is having the opportunity to mentor young investigators and younger faculty and encourage them to also become interested in research in pediatric cancer. And many of them have gone on to make remarkable discoveries that have led to further improvements in the treatment and the survival of children with cancer. Of course, part of this, I have to say, during this International Women's Day, is to focus on other young women who are interested in pursuing a career in pediatric oncology and encouraging them to also conduct research in an effort to improve the outcome of children with cancer.